put your questions in the chat, but don't wait till the discussion. I mean, if you've got something pressing that comes up, put it right away into the chat and we'll keep looking at it as we go and plan how we're going to handle the discussion. So basically, there's a varied landscape. If you start to look at university vaccine mandates, over 700 US colleges and universities have some form of mandate, and some Canadian universities require proof of vaccination. I've just listed a few here, or regular testing to access campus. Some universities, such as UBC, don't have an explicit mandate, but they do require rapid testing with exceptions for those already vaccinated. Others lack a mandate, but are requiring vaccination to participate in certain activities, such as living in residence, going to gyms, and as we've recently seen, McGill is going to be requiring it for going to the library as of mid-October. The modalities for confirming vaccinated status vary. So in some instances, students have to upload their record of vaccination into their student record. In other cases, they have to show a sticker on their card. It seems to vary across the country. The public opinion on university vaccine mandates is fairly high. This happens to be the Americans in April, May, June, July, and you can see the fourth bar down there, 66% are in favor of requiring college students to get a COVID-19 vaccine in order to go back to university. Polling data specific to colleges and universities in Canada are limited, but general support for mandates appears higher in Canada than in the US. So for example, a poll done by Ipsos August 19th showed a strong majority agreed with the recently announced mandatory vaccination for federal public servants. A strong majority agree with the requirement for proof of vaccination for flying on an airplane or taking a train, whether that's international or interprovincially. And similar proportions support mandatory vaccination for healthcare workers, 84%, for teachers, 81%, or vaccine passports to enter restaurants, gyms, or other indoor spaces. So in terms of mandates and infectious disease dynamics, we don't have a lot of data. So we're having to sort of look at what seems to be likely to be the case, but we know that testing policies, mandates for vaccines and testing policies can prevent infections by reducing contacts between infected and uninfected individuals. And that's through increased case detection, but also limiting participation in specific activities. They can reduce transmission, and that's conditional on the contact lowering the transmission when a vaccinated individual encounters an infected individual. And there's some evidence now to show that viral loads, although they're high with the Delta infection in any breakthrough infection with vaccines, the duration of contagion appears to be less among vaccinated people. And of course, vaccinated people are much less likely to get infected. Preventing secondary infections by reducing the proportion of symptomatic infections and the level of symptom severity. So the assumption is that symptom severity is associated with viral load. So we're starting with the baseline level of vaccination estimated at around 90% in the McGill population. So in terms of evidence of impact, there is observational evidence that mandates increase coverage. We've seen people responding across the country as vaccine mandates come into place with increased lineups to get vaccinated in different provinces. There's some evidence in terms of school vaccination mandates among children. And intuitively, mandates appear less effective at increasing uptake among those expressing lower vaccine confidence. Now, it depends on why they're more hesitant, what are the reasons, but the mandates we're seeing are also leading to demonstrations across the country. And as we saw yesterday in the legislature in Quebec, the introduction of a bill to prevent those demonstrations from impeding people's access to schools and hospitals and other places. So rigorous causal evidence on the impacts of mandatory vaccination policies is limited, and we don't have evidence, at least to the best of our knowledge, specific to university mandates or the COVID-19 pandemic. So we're going to hear from some experts here that are going to stimulate our thinking on this and help us to understand, in particular, the legal and ethical aspects as we move forward to look at this. So I'm going to stop sharing and introduce, first of all, Richard Gold, professor in the Faculty of Law at McGill University. Richard, you have the floor.
It always helps when you unmute. Thank you very much, Catherine. Thank you, Ari. Thank you all for attending. This is something that I've been interested in because it's connected to my field of innovation. How do institutions, specifically universities, innovate themselves with new policies? So it fits into that way of thinking. I just want to add a couple of points. One, UBC is actually flipped to a proof of vaccination requirement, although their implementation is iffy. And the 90% at McGill that's claimed, we understand is based on those who are vaccinated in Quebec. And McGill's population is 52% outside of Quebec. So it's really nice that the university takes these high numbers, but we've been asking for the data and they haven't provided it. And I think that was Tim Evans's point in his question. So I'm going to divide my time with Richard Janda. And the first point is there really is no contention that universities can bring in proof of vaccination requirements as long as they have the requisite exemptions for at least medical, someone who has some medical condition that prevents them from getting that, and probably also religion. But there's really no argument that anybody in public has made to the contrary. In fact, many people have come in. And just yesterday, in fact, the Ontario Human Rights Commission made this abundantly clear. It said, while receiving a COVID-19 vaccine remains voluntary, the OHRC takes the position that mandating and requiring proof of vaccination to protect people at work or when receiving services is generally permissible under the Human Rights Code, as long as protections are put in place to make sure people who are unable to be vaccinated for code-related reasons are reasonably accommodated. This applies to all organizations, i.e., it applies to us, the university. And that is the, I can't say unanimous because there's probably someone who will take a different view, but that's well established. And so there are a whole bunch of phony arguments that have been raised, and then when that's been debunked, the universities have moved over. What's interesting is every single university just about initially said they can't do this because of law, and then suddenly they're doing it, and they ignore the legal, their legal arguments, which is indicative that there really isn't a legal barrier. So the question is, why have universities not only been resistant to proof of vaccination, but also to a whole series of health measures that public health care experts, including the School for Population and Genetic and Global Health, have stated? Why do universities not follow their legal right? Why are they hiding behind it? And here we leave the area of firm knowledge to speculation because the universities have been very non-transparent in their thinking. They give us statements of the law, they're proven wrong, they move to another one, and that has gone on for both legal arguments and health arguments. So I'm going to let my colleague, Richard Janda, go through some of the arguments we imagined could be brought. Again, since the universities have never stated the argument, you're arguing against a phantom to a certain degree. But I want to discuss that if this is true, that universities can do it, and it is true, then why are they not doing it? And I want to advance three arguments. Again, speculation because I don't know, but these seem to make the most sense because I've been thinking about this for a few months. First, I think they're doing it to avoid both political and social blame for infections. So they know quite well, unless they've been completely blind and deaf and dumb to everything that's happening, that infections will happen and it will get into the community and deaths may result. It's hard to believe that they don't know that that's at least a strong possibility, probability. But what they don't want is to be blamed for it. And so what they seem to be doing I argue, is they are hiding behind the law to get there, and I'll expand on it. The second argument I'm going to put forward is simultaneously with that and hand in hand with that, the universities are using the crisis to consolidate power at the administrative level and really downgrading the governance institutions at the university. That is, they're usurping power away from the way we usually make decisions. And then the third is they are actually buying into or using or relying on forms of systemic discrimination against the disabled. They're saying it's their problem. It is not our as a community problem. So let me go through that, hopefully not too long. So the first is, why are they mounting these phony arguments that Richard will go through? And I think the best example is something that just happened last weekend at McGill. On Saturday, there was a stabbing just outside the ownership, the property owned by McGill on the sidewalk. On McGill's maps, this is considered the downtown campus, but it wasn't technically on McGill land. But libraries were closed. The campus was closed off for hours. McGill uttered not a word, didn't say, watch out, didn't say buildings are temporarily closed, don't come. Even since then, there has been no official word from McGill. This is kind of strange because just a week before there was a suspicious package on campus, and they sent all these warnings out to everyone, don't come to Arts Building, they cleared it away. That they were willing to do. So why not here? Well, the argument seems, I think, is that they don't want legal liability. So they want to say this happened outside of our land, we are not responsible. And so rather than focus on protecting our population, our community, they just want to be shut up so that they can't be blamed for whatever incident happened. And I think that's what's happening here, is they know very well that there's going to be some spread, and that could lead to someone taking it home, infecting a vulnerable person, and that person having very serious consequences. They don't want to be burdened with that. So what do? They take minimal steps, and they don't share information. So we have insufficient counts. We don't get basic data on are classrooms sufficiently ventilated. They just don't bother measuring it. There's a doubt about whether they're completely transparent on data. As I said, they weren't particularly transparent on their claim that 90% of the population is vaccinated, which doesn't include faculty and staff, by the way. So it seems to be that what they're doing is trying to make it difficult for anybody after the fact, when there is a problem, to go back and definitely say it's the university's fault. So this is a very cynical use of the law to claim we can't do it, hide behind these very phony barriers in order not to take responsibility for what's going on, because they're afraid if they start engaging, they might eventually be held liable. There'll be data out there and there's a liability. So they don't want that. The problem with that strategy, of course, is the legal experts came out and said, these are phony arguments. The public health experts came out and said, these are phony arguments. So it hasn't quite worked the way they want. The second argument is, at the same time they've been consolidating power, this allows them not to be transparent about the reasons for their policy or for the justification for it. And so they bring it together, and so they don't have to give us data on air quality. They don't have to give us data on people because it's heavily controlled. And the normal bodies that would make decisions, the departments, the faculty councils, Senate, are really pushed aside and not given real authority. They have often mock debates and other things, but they're not allowed to engage in a substantive way with the issues. And that consolidation of power is good for now, but it's also a trend we've seen over a couple of decades where the central administration wants to control the university away from the collegial type of environment that many of us who started in academia a while ago, I won't say how long, are used to. And I guess the third argument is more subtle, right? They're two ways to look at the situation. One is they're vulnerable people, right? The immunocompromised individuals with certain health conditions, acute health conditions, that if they get infected, despite being vaccinated, could potentially have more serious consequences. Pregnant women who themselves are at risk, but also at risk of giving premature birth, and individuals who, because of their family status, are caring for vulnerable people. So we know that. There are two ways to say this, to deal with it. One is to say it's their problem. They're the other, and so they have to ask for accommodation. They have to reveal private health information to get that, and the university is often stingy about granting it. So if many students have been told, if you want to be safe, take the year off. Well, you've moved, you've quit your job. That's not a realistic option. The university doesn't feel an obligation to accommodate those students beyond that. Individual professors might, but not the institution. But the other way to have thought about this, and one would hope a charity, which is what our universities are, would think this way, is this is a community problem. We are jointly suffering from the impact of COVID, and no one group ought to have the responsibility of taking care of themselves. So let's think about how we can accommodate those people or change the way we teach. Automatic online options, recording of classrooms, allowing us to bring HEPA filters inside when the ventilation is not good enough, actually measuring it, proper masking mandates, lower crowding. There's a whole bunch of things we could do to make the on-campus experience less dangerous, but also provide a real alternative. So we haven't done that. And to me, the legal arguments that the universities have raised are really red herrings. This is all about them trying to avoid responsibility. However, they keep raising it. So I'm going to turn it over to Richard to show you how bad their argument is.
Oh, thank you, Richard. Fine opening foray there. I didn't mention that Richard is the director for the Center for Intellectual Property Policy and a James McGill professor in the Faculty of Law, and also an associate member of the Department of Human Genetics at McGill University. Richard Janda, who's going to speak now, is an associate professor in the Faculty of Law and associate member of the Bieler School of Environment at McGill University. So Richard, number two, take it away.
Thank you so much. And I want to thank Catherine and Ari, not only for organizing this event, but to thank the School of Population and Global Health for being leaders on these questions. We have a remarkable faculty here with expertise on epidemiology, and one of my regrets is that that school has not, as far as I can judge, been as consulted as it ought to be on matters within your expertise. What I want to emphasize, I suppose, is the exact character of the legal argument being made by the university, which has frankly evolved when 12 law professors wrote on the 16th of August to encourage the university to implement proof of vaccination. The university had stated on its website that this was not possible legally in Quebec, that the university was impeded in Quebec from putting such a mandate in place. And if you go back to that same website now, the frequently asked questions about COVID-19, that statement is no longer there. And what has been substituted instead is a much more wishy-washy, from my vantage point, statement about how the university at this time doesn't think it's necessary to implement further measures. What had inspired our initial foray as law professors was that we had seen evoked the protection of human rights as a reason why the university could not implement a proof of vaccination. I happen to have been a member of the Quebec Human Rights Commission in the past, and the former president of the Quebec Human Rights Commission is now, in fact, the president of the University of Ottawa, and we were responding, in fact, to the implementation of a proof of vaccination scheme at the University of Ottawa at the time in August, knowing that, of course, if Jacques Frémont had gone through the arguments and understood exactly what was to be weighed as regards human rights concerns, that he probably had the law right. That's his area of expertise. So we did some research, and we came to pretty quickly a conclusion that wasn't difficult to reach, and which Richard has already noted. The Ontario Human Rights Commission has also recently reinforced publicly, namely that it is not a form of discrimination to ask people for proof of vaccination if they want access to spaces where they might put other people at risk. This doesn't require that the university stick a needle in somebody's shoulder and impose a medical procedure. That, frankly, has been the way that the general counsel of McGill University has put it. She's made it sound as if McGill would be coercing vaccination and coercing invasion of bodily freedom and privacy. That's not what a proof of vaccination requirement involves. What it involves is telling people that if they want the privilege of access to space where there are other people who might be exposed to risk, that they should either, on the one hand, show that they're vaccinated, or give some explanation as to why they aren't, which could include, of course, medical reasons, which could include reasons of religious conscience. But under those circumstances, of course, as is the case in other universities, they would then be subject to ongoing testing and demonstration that they weren't posing a risk to others. In essence, discrimination is not some general open-ended notion where if you treat different people differently, that you are subject, therefore, you're therefore violating rights. There are grounds of discrimination that are recognized by law, including, for example, on the basis of religious conviction, on the basis of race, on the basis of gender, sexual orientation, on the basis, of course, also of disability. If the university engages in distinct treatment on those grounds or on analogous grounds, then it could be involved in the process of breaching rights. And by the way, as Richard rightly mentions, the position we've taken is that, in fact, the university currently is involved in discriminatory practice because of the differential impact of its policies on precisely people who fall within those enumerated grounds of discrimination. The pregnant women, for example, those who are disabled, those who might have children at risk or others at risk at home. In those kinds of cases, there is indeed a problem of discrimination if you have a differential impact upon those folks, because they are then placed in the situation where they've got to choose between coming to class on the one hand, or coming to the university, or and putting themselves at risk, or not being in class and thus at a disadvantage with respect to others. So if we return to the people who don't want to be vaccinated for reasons that don't fall within any of these explicit grounds of discrimination, they are not afforded the protection of human rights codes. They are not doing it on the basis of a creed. They're not doing it on the basis of some specific vulnerability that the law will protect discrimination against. They're doing it because they don't want to be vaccinated. And the simple question is, upon whom should the burden fall of being excluded from the campus if they're producing vulnerability for others? Should that burden fall upon those who are immunocompromised? Should it fall upon pregnant women? Should it fall upon those who have vulnerable family members at home? Or rather, should that burden fall on those, the small fraction of those who, for their own reasons, don't want to be vaccinated and therefore are putting others at risk? This doesn't mean that those people would be cut off from access to quote unquote an essential service. And I'll say something a little bit more about essential service in a moment. It means that they could still have access to classes online. They could still have access to recorded classes and so on. Accommodations that we're now having to make precisely for those whom we're discriminating against. So where should the burden fall is the simple point we've been making to the university, and we're saying that that burden should not fall upon the vulnerable. It should fall upon those who, for whatever private reason they have, don't want to get themselves vaccinated. Now, I want to say something about a little bit more about how the university has framed its argument. I alluded already to this point concerning how the General Counsel has stated publicly over and over again that the university can't force vaccination upon people, and I hope you can see why, in our view, that argument is frankly specious. But there has been, another kind of argument which is implicit in the university's position and has been made more explicit by the rector of the University of Montreal, which is that the university should take the least intrusive measure possible when it comes to assuring protection against risk. There's a kind of implicit cost-benefit analysis that has crept into the argument, and what the university has been saying, we think more and more explicitly, is the measures we're taking are good enough and not too burdensome upon people. And if we feel that that is giving us an adequate, risk profile at the end of the day on campus, there's no reason to go beyond what we're now doing. So it's enough that we will start deploying the vaccine passport, for campus events. It's enough that we will eventually deploy it in libraries. Because if we take these kinds of less intrusive measures, frankly less costly measures for the university, because the university, if they want to do a proof of vaccination requirement properly, will have to have personnel deployed to check if people have been vaccinated. The University of Winnipeg, for example, has done this extremely well. They've had every student come with their student card, show their proof of vaccination, and then get a little green sticker put on their student card. So whenever they show up, if they show their sticker on their student card, they can come into the building. Otherwise, they can't come into the building. That's an effective proof of vaccination methodology. But it takes some planning. It takes some resources. And clearly, for now, the university is unwilling to put those resources towards the problem. So the university's view is what we're doing is enough. And frankly, the resolution that was just passed in the university's Senate, which creates an ad hoc committee to study further possible measures and the university's response to this, is now, in my judgment, running cover for this kind of hands-off approach, because what the university has said, and I'll quote the precise wording of the resolution, is that if it is possible for the university to include the extension of a vaccination passport to curricular activities, if the university deems this to be operationally enforceable and justified. That's what the university's Senate has just voted. So we've left it in the hands of the administration to determine if, in their discretion, they believe this is now operationally justified or operationally necessary. The simple answer to that is, show me that it isn't justified now. We know, and you are School of Public and Global Health, to help us understand the significance of the Delta variant and the potential for spread of the Delta variant, not only at McGill but through the Quebec population. The kinds of measures that we're imagining are not so burdensome that the additional protection afforded is not protection we should be seeking. I happen to be a teacher of civil liability, and this is the classical test for when one is diligent, adequately diligent. Is the burden upon you to take additional measures so severe that it doesn't match the probability of harm? The probability of harm here is of significant harm. It doesn't have to be 50%. It has to be some significant probability of harm that arises. As I defer to the experts in the room, but as far as we know, there is that significant probability of harm, and the burden upon the university is not so significant that it ought not to take that additional harm into account. So the foundation from the point of view of civil liability seems to be very strong, that the university should be taking additional action. And maybe I'll say one last thing before leaving it to the other members of the panel. I think that it's important to distinguish between proof of vaccination on the one hand and the vaccine passport on the other. The Senate resolution that I just mentioned speaks of the extension of the vaccine passport. That might be viewed by some as rather severe, rather strict, to have everybody have to show the Quebec vaccine passport. When we spoke of proof of vaccination, we were saying that it should include accommodation. And among other things, proof of vaccination could allow international students to show what vaccination they've been through when they may be facing administrative challenges to getting the Quebec vaccine passport implemented. We know that there are such issues out there. So proof of vaccination gives a little bit more flexibility to the university to verify whatever QR codes and other proof people may have, and give them that green sticker on their card for a range of reasons, including if they have the vaccine passport. But it also would extend accommodation to those who can't be vaccinated for medical reasons and for religious reasons, and then subject them, of course, to some kind of ongoing testing protocol. So I'm just emphasizing that because the way the Senate has just put its resolution makes it sound as if it's either going to be the vaccine passport, or nothing. And we think that that's an unfortunate way of framing the options that are available to the university. Thanks.
Thank you, Richard. You've raised a number of issues. Thank you for the clarification at the end there about proof of vaccination versus the vaccine passport, because vaccine passport kind of raises this issue of whether universities are essential or non-essential activities, and then we get into what's the constitutionality, that the Charter of Rights and Freedoms applies to government services and so on. So is the university quasi-governmental or not? I think in the discussion, I would like to hear more, and perhaps other people would too, about what kind of solidarity there has been or hasn't been amongst the universities in Quebec, because we keep hearing about Quebec law and whether that makes a distinction as to how we view these issues. So let's move on. Our next presentation is going to be, or discussion and points that are going to be raised, is going to be from Claire Downie, who's the Vice President of University Affairs in the Student Society of McGill University. Claire, we're really looking forward to hearing your views. You can have the floor now.
Thank you so much to everyone for having me here today. It really means a lot to be able to speak on behalf of students. Please let me know if you ever can't hear me. I do live on a busy street, so there's quite a bit of back and forth. So SMU is the Student Society of McGill University. We represent the roughly 24,000 undergraduates at McGill University, as well as students in the faculties of law and medicine. We have been advocating for expanded safety measures on campus all throughout the summer, and took the stance on supporting mandatory vaccination a little bit over a month ago. Unfortunately, a lot of the discussions being had here are nothing new to McGill students. And I'm going to touch a little bit on why that is, but students know that their health and their safety and their well-being are not a priority, and the unwillingness of the university to implement a vaccination requirement is really emblematic of that. So as Dr. Gold and Dr. Janda have mentioned, there's when you refuse to implement a vaccination mandate, you're putting others at risk, you're putting vulnerable people at risk. And essentially you're saying that you're going further to protect people who've made the choice not to be vaccinated, rather than protecting people who are vulnerable or otherwise immunocompromised. They don't make a choice. That's a health condition that they're living with, and you're saying that the right to giving access to someone who's unvaccinated at all costs is more important than protecting the rights of vulnerable individuals. This disregard also does go hand in hand with the lack of accommodation. So what we were hearing a lot at first from McGill administration as well as from students is, well, if it's not safe for someone to be on campus, the university is going to accommodate them. And unfortunately, that's not at all true. The university has not been willing to give long-term medical exemptions to students, faculty, or staff who are immunocompromised or otherwise vulnerable to serious effects of COVID. It's not just sort of these borderline cases where people say, well, I don't know if that really counts. There's really glaring circumstances, medical conditions where health experts would say, yes, this person would be at great risk if they contracted COVID-19, and the university is saying, well, no, we can't do that. Our campuses are safe, you need to come into class, and if you can't, you can just take a year off, which, as the previous speakers have mentioned, that's not really feasible. Undergraduate students too are often dependent on financial aid, and dropping out of university means losing the source of income that you used to support yourself. Again, and the requirements for obtaining accommodations are intrusive. They're inaccessible. You have to give all of your medical information to McGill administration with no idea how many people are going to see those. But that's the same logic that's used to say that McGill can't collect information about vaccination status, or it can't share it. But that seems to have changed quite a bit as well. Again, it's unbelievable to me that asking about vaccination status is more invasive than asking students who are disabled or vulnerable to share all of their medical information with the university. That's not an appropriate argument in my mind. So a couple of weeks ago, on the first day of classes, myself and a coworker on behalf of SMU held a protest in front of the James Administration Building for a safe and accessible campus. And while the main goal of the protest was to speak with administration and show support for increased safety measures, accommodations, and a vaccination mandate, it actually, one of the most productive parts of the day ended up being speaking with students. Because I think in the circles where vaccine mandates and campus safety are being discussed, we assume that a lot of us have the same sort of base level of information, but in reality, many students aren't as tuned into these issues. So we had a lot of discussions about what a vaccination mandate means. And as other speakers have touched on, it doesn't mean that one day students who can't be vaccinated or aren't yet vaccinated are just randomly kicked off campus. When peer institutions have implemented these requirements, they've given lots and lots of time for students who haven't yet been vaccinated, haven't had the opportunity, especially if they're coming from abroad. There are these grace periods. And again, many of these mandates do include exemptions for students who are unable or do not wish to be vaccinated. They're given often access to testing rather than being asked to leave the university right away. And I think there were a lot of students who didn't understand that a vaccine mandate it looks different in a lot of places, and there really are accommodations being made for those who need them. It's just the goal is to ensure that the supermajority of students on campus are vaccinated. Another thing I wanted to touch on was McGill's claim that the vaccine mandate is unnecessary given the positive figures surrounding vaccination rates in Quebec. And I'm American, so I look at the Quebec vaccination rate and I say, yeah, this is a very positive number. This is good. Most people have taken the choice to be vaccinated and they're protecting themselves and others. But one of someone on Twitter, I can't remember who it was, I apologize, made a really thoughtful point a few weeks ago of McGill's, the rate that McGill claims to have of 85, or now I've heard 90%, that's good, but peer institutions have rates that are upwards of 98%. And that's not just a few students. Our McGill is a giant school with, I believe, about 40,000 students, as are many of our peer institutions. So the difference between 85% and 98%, or 90% and 98%, that's potentially thousands of students. That's not an insignificant number of people. So really the claim that, our rates are so good, we don't need to do this, that's potentially, that makes the difference between thousands of students being vaccinated or not being vaccinated. And that's really staggering. So something I did touch on before is that unfortunately a lack of prioritization for student health and safety isn't really anything new for students. SMU has been vocal in the past about issues surrounding the Student Wellness Hub, where McGill says, oh, we can't have more doctors. We have lots of alternative resources, but in reality, many students who go to the hub in emergency crisis situations, such as a need for psychiatric care, will be told that there are wait times. There are months-long wait times. They are told to seek alternate resources, to pay out of pocket for private care, when in reality, that's really just not an option. We know that McGill is a very influential school in Quebec and in Canada, and they do have the means and the resources. It's just that student health and safety and psychiatric care is not a priority. Students know this, and unfortunately, the lack of a vaccination mandate really is emblematic of that. Students say you could do this. It's just that other things, such as your reputation, such as your image in the press, political pressure is more important than student safety. And increasingly, students are aware of that. They know that the university isn't prioritizing their safety or their mental or physical health. They're prioritizing their reputation. This, I believe, is a lack of trust, and it has continued and will continue for generations of students. It's going to be very, very hard to rebuild trust for students. Students know right now that they're in unsafe situations. I suppose for context, one of my main roles at SMU is taking student concerns about academic and accessibility concerns and helping to support students in situations like that. So I received countless emails from students who are saying it's not safe for me to be on campus right now, and everyone has a good reason. It's their own health conditions, it's their family's health conditions, it's other loved ones in their life for whom a COVID infection would be devastating. And they've all tried so hard to go through the proper channels that McGill claims exist for accommodations, for academic considerations, but in reality, those channels they're there, but they're not designed to work. They're not designed to provide students with the access to safety and resources that they need. And again, that is really emblematic of the way that McGill has been handling things hands off, claiming it would be overly burdensome to have such requirements. Other panelists have also spoken about the Senate motion. I unfortunately do believe that this was a very lost opportunity on the part, especially of the Senate Steering Committee, to redelegate some power that has been granted to the Emergency Operations Committee. So in terms of university governance, the Emergency Operations Committee has been calling all of the shots since the beginning of the pandemic, even on issues that aren't strictly operational. So for instance, academic issues related to COVID-19 on campus, the EOC really still has been making all of those decisions in large part. That's poor governance practice, and it's a very dangerous precedent that one day this special committee for one specific thing can just come in and take all the power. It doesn't allow for other channels of procedure to be followed, and that's incredibly concerning. Students are also aware of that. I'm personally disappointed by the Senate motion. It really does seem like posturing on the part of admin to say, Senate did this, we're working so hard towards something good, when in reality, it was controversial to get something even that toothless on the table. And that is really unfortunate and extremely emblematic of the conditions on campus and in campus governance right now. So just to summarize, students are very supportive of a vaccine mandate. There were a lot of great conversations had with students at SMU's protest. We did have conversations where people would say, oh, well, I don't think anyone should be kicked off campus just because they're not vaccinated yet or they're not sure. when in reality, that's not what a mandate actually looks like. A mandate looks like students who can't be vaccinated being given appropriate accommodations. It doesn't just mean that one day people are randomly kicked off campus because they're not vaccinated. The policies we've seen are really positive, and they do provide accommodations for, the policies we've seen at peer institutions, not at McGill, have really been positive, and they have provided for accommodations for students and staff and faculty who need them. Again, it isn't just, McGill is cornering you and shoving a vaccine in your arm, or one day they kick everybody who's not vaccinated off campus. It's really about ensuring the health of the whole population of Quebec, of the greater Montreal community, and about protecting individuals who don't have a choice about being in the world. People don't choose to be immunocompromised or disabled. And again, all of the onus to protect themselves or seek out their own accommodations is being placed on them rather than on people who have made a choice not to be vaccinated. And unfortunately, that is nothing new with McGill, but we remain hopeful that because of all the collaboration of students, faculty, staff, and some of the incredible organizing that's gone on, we remain hopeful that the university eventually will make a choice, even if it is far too late, that the university will make a choice to protect students and other vulnerable community members. Thank you.
Thank you, Claire. That is so, so helpful. I mean, we understand concerns about student health and safety. We're seeing faculty express concerns about their health and safety. We're seeing a general disappointment in McGill's lack of leadership in the university community just to take this forward and be a good member of society within the province and within the country. So you've raised a number of issues, and I think it'll be interesting when we get to the discussion to pull out some of these, because you ended on a positive note that we can make change. We just got to figure out how to do that. So let's go and hear now the ethical perspective, or a perspective on ethics, from Max Smith, who's an assistant professor of bioethics and health in the Policy School of Health Studies in the Faculty of Health Sciences. Max, what can you tell us? What do you think about what you've heard, and what can you tell us?
Thanks very much, Kate, for the introduction, and thanks to the IHSP for the opportunity and for everyone for being here. I have to give a lot of credit to Richard and Claire, because you've either made my job very easy or rendered me kind of useless, because you've provided some very cogent arguments in favor of vaccination mandates on campus. So what I thought I would do, though, is despite the arguments we've heard and the pleas we've heard, there may still be ethical reservations about mandates in general, which might frustrate the ability to put these in place. So what I hope to do in the short amount of time that I have is to, first of all, just try to paint the picture of that ethical justification for vaccination mandates, to address some of those reservations. And then I'll briefly consider some of the unique ethical considerations that emerge for vaccination mandates on campus. So I just want to acknowledge that a lot of what I'll be saying is informed by some work that I've done for the World Health Organization and an article with some colleagues in University Affairs on this topic. Okay, so in terms of the general ethical justification for vaccination mandates, Kate, I'm glad you started with this, because it really does start with the science, and it's important to note that. So as Kate astutely mentioned, the vaccines are very effective at reducing infection, severe disease, hospitalization, and death, and also transmission. And we know that being vaccinated is very safe relative to most other risks, medical or otherwise. I've just pulled these data from Health Canada. Only 0.008%, that's not 8%, that's not even 0.8%, 0.008% of the 54 million doses that have been administered in Canada have resulted in severe adverse events like anaphylaxis. But it's really important to note that the science isn't everything. It isn't sufficient. And we often see this in social media. People will point to the scientific basis for vaccination, therefore mandates are ethical. And we need to do a little bit more work in addition to the science to flesh out that argument. And it's not that hard to do. And so if we take the two premises that I've sort of just started with, that vaccines are effective at preventing these sorts of severe outcomes, that they're safe and therefore represent a minimal burden for nearly all people, we can add this normative or ethical premise to say that one ought to prevent suffering and death, especially when doing so carries a minimal burden. And so when we add that ethical premise to our argument, then we can license this conclusion that one ought morally speaking, to be vaccinated. But what about mandating vaccination? So that's why we ought to be vaccinated, but it doesn't necessarily speak to the question of mandates. I think the argument that I've just presented has greater moral force in two different scenarios. In the first, when there's greater risks of suffering and death, or greater risks of infection or transmission that may then lead to suffering and death. And so particularly in the latter part there, we can think about congregate settings or big university settings where there is a greater risk of infection or transmission. And second, the argument has greater moral force when there are special fiduciary obligations or relationships of trust between the persons considering whether to be vaccinated and the persons at risk. And arguably, we could talk about the different sort of fiduciary obligations that exist in healthcare or even in university settings. And so vaccine mandates are really a response to this conclusion insofar as they arguably work to, and this is where I'll draw on a bit of uncertainty that Kate mentioned in her introductory remarks, the vaccine mandates arguably work to increase the number of people vaccinated. They arguably ensure greater vaccination coverage in particular settings like universities. So even if they don't increase the total number of people vaccinated, at least we can be more confident in the coverage in the setting that we're talking about. And then finally, quite unrelated to just the setting itself, if we prevent more people from getting sick, we can prevent the overwhelming of our hospitals. So they provide more moral force to mandates in that sense as well. And so I think this allows us to reach the plausible conclusion that there's at least a defeasible reason to believe that vaccination mandates are ethically justifiable. They're defeasible insofar as we might have other reasons to revise the conclusion that we have. And that's what I want to spend the next few minutes discussing, which is whether if we consider other sorts of things, does that mean we should revise our view about mandates and maybe think that they can't be justified on campus? So I'll touch on each of the points mentioned here. So first of all, I think informed consent is often raised. This will be raised on campuses, but more generally in discourses around mandates. For those unfamiliar, informed consent for something like a vaccination is valid if it relates to the treatment itself. It isn't overbroad in general. If it's informed, if it's given voluntarily, and if it's not obtained through misrepresentation or fraud. You can undermine informed consent in a lot of different ways, but the relevant sense here, I think, for mandates is that third point, whether vaccination is truly voluntary, if we're requiring people to get it. And Richard Janda had mentioned this idea of coercion before, and I think that's something that requires unpacking. If people think that vaccination mandates are coercing our students, staff, and faculty, then they might think that this renders informed consent involuntary and therefore is unethical. So I'll just unpack that very briefly. So I like this definition of coercion, which says that it is a threat that makes a certain choice irresistible. And it's really important here to note that irresistible doesn't mean how the victim feels about their choices, right? It really is that their choices are weighted so heavily that one reasonable course of action remains. Only one reasonable course of action remains. It's not just I don't like my choices. And so I think if we think about this in the context of a university mandate, the paradigm example is sort of your money or your life, right? This is yes, you have a choice, but it's quite clear that you only have one option here. So if we place this in the context of a university, employment at a university or studying at a university involves many choices that are arguably irresistible due to the threat of sanction or dismissal, such as getting to work on time, wearing a mask, completing an exam. These are all things that we must do, or else there is some threat that we may face. But of course, in these settings, a reasonable course of action often remains, whether it's temporary leave, whether it's quitting if you don't like that particular position you're being put in, deferring, learning virtually, so on and so forth. But I think if we unpack this a little bit further, it's really important to note that if you've been vaccinated, you'll understand that you may opt not to be vaccinated at any point. You can get out of the chair and walk out of the clinic whenever you'd like. And this is the important moral sense in which informed consent is voluntary. That you must be vaccinated to work or study at a university, or to be an astronaut, or to be a healthcare provider, serve in the military, and so forth, doesn't render your choice separately to be vaccinated involuntary. Rather, it renders your choice to continue to work or study at the university more constrained. That's what's being constrained in this context, not necessarily your prior informed consent about being vaccinated or future informed consent. And so employers don't have to employ you if you choose not to meet the reasonable conditions for employment, and universities don't have to enroll you if you choose not to meet the reasonable conditions for enrollment. There's an important caveat here, which has been mentioned by both Richards, which is the issue of discrimination, right? If you are being told you can't work in a particular setting or come to school on grounds that you feel are discriminatory, that is where there would be an exception to what I've just argued. But as Professor Gold rightly pointed out, the Ontario Human Rights Commission, they are the ones that advance anti-discrimination, at least in Ontario and similarly in other provinces with different sorts of bodies. And they have said that requiring proof of vaccination to ensure fitness to safely perform your work or to protect people receiving services such as students or living in congregate housing like residences may be permissible under the Ontario Human Rights Code if the requirement is made in good faith and is reasonably necessary for reasons related to health and safety. The important rejoinder that they have is that organizations have a duty to accommodate people who may not be able to receive the vaccine for reasons that are related to grounds upon which we don't allow for discrimination, such as disability or creed. But importantly, unless it would amount to undue hardship based on cost or health and safety. So there actually are grounds where we need to accommodate, but there's still a way out if it amounts to such an undue burden to accommodate those individuals. And so they note, and I just wanted to highlight this, that the right to be freed from discrimination can be limited under the Ontario Human Rights Code, where broader health and safety risks are serious, like in a pandemic, and would amount to undue hardship. And so that's where you see even religious exemptions or exemptions on the basis of creed are sometimes, in some cases, being overridden given this prospect of the threat to health and safety. Okay, two more things to address here. There is an argument about liberty, that mandates constrain our liberty in some way, and so they ought not to be considered justifiable. But of course, liberty is not and should not be privileged above all other values. So insofar as it does constrain our liberty, that doesn't necessarily tell us that it's wrong. And this is an argument that dates back many centuries. We have our right to swing our fist, and we can do that as much as we'd like, except insofar as it might touch your face and harm you, right? So we have liberties, but they are, of course, constrained in many important ways. And importantly, the ACLU recently came out and said that far from compromising civil liberties, vaccine mandates actually further civil liberties in lots of important ways. I'm teaching in person and I feel comfortable doing so by virtue of these mandates. They protect the most vulnerable among us, including people with disabilities and people with fragile immune systems, children too young to be vaccinated, and communities of color hit hard by the disease. And just to situate this even within our own our charter in Canada, in Ontario, at least, we do have a directive from government that this is required at universities. So this could be engaging Canada's Charter of Rights and Freedoms. And in fact, Section 1 of the Charter affects a balance between the rights of the individual, such as the right to liberty, and the interests of society by permitting limits to be placed on guaranteed rights and freedoms. So liberty isn't something that we have unfettered rights to. Okay, and then finally, I think there's an important equity consideration that we need to think about here as well. Mandates, of course, may disadvantage certain populations who are unwilling to be vaccinated. And some may not care about this, in particular, the populations who might believe they're being microchipped and just say, well, if it disadvantages them, so be it. But we know that some populations may not be vaccinated due to reasons of mistrust or distrust owing to histories of oppression, marginalization, and even unethical medical experimentation. And so disadvantaging already disadvantaged populations can exacerbate social inequity. So we need to absolutely be alive to this concern. But as mentioned by others and even by the American Civil Liberties Union, mandates could actually promote social and health inequities by better ensuring healthcare settings, workplaces, and universities are safer for populations that are experiencing vulnerabilities to COVID. Okay, in the few remaining minutes that I have, I'll just touch on how this plays out uniquely in the context of universities. And I'll start by noting, I just did a little bit of research this morning to note that even McGill's Faculty of Medicine has such a requirement for immunization. So this isn't new in university settings. And if you pull up this policy, you'll note that all students in the Faculty of Medicine must be immunized against hepatitis B and must have their hepatitis B titers measured. They need annual vaccination for influenza. This is something that we don't even require in many healthcare settings. And vaccination against other infectious diseases may be required if need arises. It states that students who do not meet these requirements may be asked to withdraw. So these are things that we have precedent for and perhaps can draw on the same sorts of arguments for COVID. Even at Western, we have the same policies as I just mentioned, and even requirements that people working with animals have rabies vaccinations. So these are quite common already. So I'll just note why, I've been in many conversations with senior leaders at universities, and they've sort of come along with me on this argument and conclude that, okay, I'm in favor of vaccination mandates, but there's policy barriers to implementing them and making sure that we can do this in a reasonable way on campus, whether logistical or operational. And I think this is where we can help our universities, if they're not ideologically opposed, at least get on board to think through some of the different issues that need to be addressed if these are to be ethical. The first is vaccine accessibility. I think that's kind of a no-brainer and easy to do. We can't mandate people be vaccinated if we don't make them very easily accessible. If you have any barriers to becoming vaccinated, that's problematic. Vaccine type is a really interesting issue that we had to think a lot about, at least at Western. We have a lot of international students, as does McGill. What do you do with those that received the Sinovac vaccine or another sort of vaccine? They've traveled here. Will they fit within this policy or not? Are we going to offer one dose of Pfizer or Moderna to kind of bring them up to where we think they ought to be? These aren't insurmountable questions, but they need to be addressed because they really frustrate the policy aims of these sorts of mandates. We need to think very carefully about who's exempt and what sort of accommodations can be provided. Although I noted before that this doesn't necessarily mean that students still have to come to campus, even if they need to be accommodated. Other sorts of accommodations can be put in place, and they shouldn't amount to undue hardship. I worry a bit about non-compliance and enforcement. This needs to be fairly implemented, and we have to make sure that this doesn't disproportionately disadvantage certain members of our campus community, because we know that policing powers often have that ability. Evaluation is going to be critical. How long are these going to stay in place for? What are the metrics that we're looking for to tell us that they're no longer necessary? I support vaccination mandates on campus, but it's not quite clear to me what metrics we're going to be looking to tell us this is when we should stop using them. And that's going to be really important to make sure that we know that they're working, know that they're not working, or know that some populations may be disproportionately disadvantaged by them. And then finally, I'll just end, and I think this really speaks to Claire's previous point, is that if we are making these decisions on campus, they need to be made in a fair and inclusive way. This coming from the top down can get a lot of people's back up, particularly those that might be hesitant or resistant to being vaccinated, and they might be seen as decisions that are illegitimate. If there are processes to involve and include the different perspectives of campus communities, even if people are on the fence about this, they may see those decisions ultimately as being more legitimate. Thanks very much for your time, and I look forward to the discussion.
Thank you very much, Max. And I guess, just off the top, Western University, what have they done in terms of vaccine mandates?
So we have a full mandate in place. You are required to upload your receipt of vaccination, proof of vaccination to the system. You're not allowed to come to campus if you haven't done so. In terms of enforcement, that is done in more strict ways, less strict ways, depending on where you are on campus. If you're in residence, it's quite easy to enforce. You don't get offered a space in residence if you haven't shown your proof of vaccination. Showing up on campus, going to libraries, going to classes, of course, we don't have people stationed at the doors, but the enforcement mechanism there really is there are sanctions in place if you come to campus and haven't been vaccinated and haven't uploaded your proof of vaccination. And in fact, there are building ambassadors on campus who can routinely check people's IDs and see if it actually aligns with their proof of vaccination online. So the threat of sanction, I think, is the thing that's doing the enforcement of that policy on campus.
Okay, thank you. So thanks to all of our speakers. This is just stimulating all kinds of questions, I think, in people's heads. I'm going to go first, perhaps, to Olga, who made a comment very early on. And Olga, you can speak in person. That you wanted to talk about responsibility for people getting sick despite precautions, and that people could argue the university has not done everything possible. Olga?
Yes, can you hear me?
Yes, we can.
So Richard actually answered in a message. And my point was, it didn't seem logical to me to say we do nothing so we cannot be blamed, because that to me is the first thing you can be blamed for. But Richard pointed out a kind of cynical view that they do that so that you really can't say where you got infected. And I mean, I must say I have, in this like 2 weeks, McGill has destroyed any trust I ever had in it. So I'm now willing to believe anything that, but it just, I don't know, because it seems to me, okay, so the first case you cannot say where they got, but if suddenly a classroom gets infected by that first case, then again, it's McGill's fault for not having implemented measures. So I just still don't find it logical, but what can I say? I mean, that's what they did. So they must have had their reasons, and clearly these reasons are not one I can understand.
They certainly are leaving themselves vulnerable. I think you're correct in highlighting that. There's a question from Derek Jones about declining vaccine for religious or medical reasons. I just want to clarify, there are very few medical reasons to decline a vaccine. I mean, if you've had a bad reaction to the first one, that would be one. But in generally speaking, you know, physicians can't really understand what people are talking about when they want a medical exemption. We're just not seeing it. And just to clarify something from earlier on, immunocompromised people and pregnant people do need to get vaccinated. In fact, they're at increased risk for complications. So it's really important that they do, and that we protect them from being exposed to the virus by being vaccinated ourselves. So Derek, do you want to ask about how this could be accommodated on campus, about how we could do antigen testing, for example, on campus to help those who are going to decline vaccine for religious grounds, for example? I don't know if Derek is still there, but. If not, Richard, do you want to speak to this? I mean, what are we seeing across the country? Richard Cole, what are we seeing across the country in terms of, you know, willingness to accommodate people so that they get tested twice a week or whatever? I mean, what are we seeing as accommodations for people that are refusing the vaccine on some campuses?
I can only talk about what the universities say, not what they do. And as Max made clear, and you did in your introduction, the implementation of many of these policies is uneven. Generally, they do have for those who are exempted, that small group, they're supposed to do frequent testing, but I'm not sure how often. I don't know what kind of testing and what kind of controls on it. I mean, we could contrast the Canadian situation. I mean, you talked at the very beginning about the US. If you look at the top US universities, fully vaccinated everybody on campus, everybody always masked indoors. Everybody at Harvard, for example, gets twice weekly testing, and if you're residents, 3 times weekly testing. I mean, they pile it on. I think it's much more haphazard in Canada. Like UBC, for example, offers testing kits, but it's often quite voluntary. But I don't know, Max may know better about what they do at Western for the exempted.
Yeah, so we require twice weekly testing for those that have a legitimate exemption, but of course it is the purview of the remit of the university to determine what those accommodations ought to be. And again, they have to show that it's possible. If it amounts to undue hardship, then they don't need to make those accommodations. The important thing about religious objections is that, and I know that this is the case for Western and many other institutions, it's not enough to simply say that you have a religious objection. We require an articulation of what that objection is. And if the articulation ends up being actually false in terms of the facts of the matter, if you were to argue that any of the mRNA vaccines include fetal cells, and that's why you're objecting, that's just not true. And so they would deny that claim. So you actually need to articulate what those reasons actually are and have those be valid. And the Ontario Human Rights Commission even said that this should be linked to at least some doctrine or dogma that can be documented by your faith, which is an interesting sort of check that we would like to see put in place.
Thank you, Max. There's a comment from Rena and some questions here. Rena, would you like to verbalize these? Because this is the individualized versus almost the community approach, and the definitions here that are unclear. I mean, McGill is really not working to protect the whole community McGill, the academic community. I don't know if you would like to say out loud what you're thinking.
Yeah, and I'm just not going to turn on my camera quickly because my internet's been a little shaky today. And I want to thank everyone so much for that. This has been really thoughtful and really heartening. And I'm thinking about this a little bit as a disabled graduate student, and just as someone who's interested in sort of the intersections of, you know, disability justice or accessibility, things like that. But it's been interesting to hear the university sort of articulate immunization and things like that as an individual issue when, you know, when we're thinking about disability accommodations, that test is usually on the institution. And that sort of been, I don't know, messing with my head a little bit. And also just it's been a little worrying to me to sort of see how the way the university has been talking about defining exposure. And sort of full disclosure, I also worked for a campus-based union at the beginning of the pandemic. So I've unfortunately been part of this conversation for far too long. But yeah, I was just wondering if anyone sort of had ideas on, you know, how do we work with these sort of questionable definitions of what exposure means, which has an impact on sort of who gets notified, but even thinking more broadly about, you know, what does it mean that the university is talking about immunization as a sort of individual issue, which sort of bypasses the institutional responsibility to accommodate disabled students, staff, etc.
Thank you, Rena. And by exposure, I'm assuming that you mean exposure to the virus, but we're also concerned, I think, about the safety, the air quality and the safety of some of the classrooms and the sizes of the classrooms, so that we're not, you know, other universities have done testing in different rooms and gotten a good idea about what kind of ventilation is required. And we're heading into winter where we know we're not going to be able to have all our windows and doors open. So does anybody, Richard Janda, do you want to respond to Rena and this concern that she has about this individualized focus?
Sure, I think Rena raises, you know, a valid concern, and I think earlier that Claire put some of these points, you know, really eloquently. The notion that somehow the people who are seeking these kinds of measures are even seeking a kind of privilege has occasionally been articulated by the university as if we want, you know, something special for ourselves rather than something which is in fact for others, for the sake of maintaining the health of the community and for dealing with those who are most vulnerable. And the thing I find frankly most scandalizing about what we're seeing is the inadequate attention precisely to that community effect. I happen to have had a doctoral student of mine who came within a hair's breadth of losing his life to COVID over the you know, before vaccination was available. I saw you know, the horror that produced for somebody who happens to be disabled himself, and so when I've been articulating this point of view, it's really not about me. I don't think it's about Richard Gold either. You know, thinking, well, I want to be protected myself. I don't like coming into the university and being exposed for myself. It's frankly about a collective responsibility that we have, and it seems to me that that's the way this ought to be articulated.
Thank you. That's really helpful. And I do see that in the chat, there's been a mention about this countdown to a safe campus campaign, which we can sign. This is to pressure McGill to make a change before Tony Fauci comes. I'm not sure of the date of his talk, but boy, if we haven't gotten somewhere by then, it's going to be a real issue. Claire.
Yeah, so I was also hoping to speak to the sort of notion of community responsibility and McGill's sort of failure to acknowledge its own responsibility in these things. So when campus was looking to sort of reopen for the upcoming academic year, or the year we're in now, I suppose, the university had been saying we have no cases of community spread of COVID-19 in our learning spaces. And you hear that and you say, oh, there's no COVID on campus. There were hundreds COVID cases in McGill residences, but that's not what they're calling a learning space. Again, as Rin also had mentioned, there were cases where the definition of exposure was quite dubious. So for instance, someone who had been more than 2 meters away, I believe was their barometer from someone who'd been infected, they say, well, that's far away enough. You must not have actually been exposed at McGill. You must have actually been exposed on the metro or in the supermarket or something like that. And that's really just very ridiculous. This is perhaps naive of me, but the school's concern should be someone, a member of our community or someone who our community member came in contact with is sick or dying. That's not more important than trying to point fingers at who, maybe it's possible that they caught it on the metro instead. That's absolutely ridiculous. And they try to have this image of, we're doing enough. See, we've never had any COVID infections. We've never created this unsafe environment. But I think you just have to look at a McGill residence or a McGill classroom for 30 seconds and you'll see that the school's not doing everything they could do and that the consequences of that have the potential to be devastating. I also think something important to touch on is McGill is a commuter campus. A lot of Canadian peer institutions aren't commuter campuses where students, most upper year students live on campus, but at McGill, it would be really rare to have a student living in residence after their first year. Many McGill students choose to live in Milton Park, which is the community that neighbors McGill University. The community itself has a lot of history and there's a huge population of older residents there. And obviously McGill can't police the behavior of students who live in Milton Park. They can't tell them not to go to parties when the parties are hosted in private homes, that sort of thing. But the fact of the matter is that when McGill brings back tens of thousands of unvaccinated students and places them in an environment with vulnerable elderly community members, they can't claim that they're completely, that they have no complicity in what happens there, which is unfortunately that the virus is going to be spread to older and vulnerable community members, even if they're not vaccinated. Even if they are vaccinated, my apologies, they do remain susceptible to the virus, and McGill can't claim that they have no responsibility in that situation.
So Claire, you're raising a really good point about the whole vaccine issue is, people getting vaccinated, yes, for individual reasons, but it's also for their families and for their communities. And that's just not clear. And if we have a very individualized focus and we don't have a community focus, that spills over into how we relate to other parts of society and what we do. And I think this is one of the things that we're feeling is so disappointing about McGill. We should be taking the lead. We should be showing a way forward. I think in the time that's left, I would just like to ask each of our speakers to just make some closing remarks, and I'll just start in order of where they were, and we'll finish off with Ari telling us whether we've done what he hoped we would do in this. So we'll start off with Richard Gold.
Thank you. Thank you, everyone. It's a great discussion. I think it's quite clear that there really aren't any barriers other than political internal barriers to them doing them. There are some cost ones, but those can be accommodated. I think we just have to hold the university's feet to the fire and set a date. And that was part of the countdown to Dr. Fauci, and just say, we demand as a community that by this date, certain things are actually implemented and others, which take longer, have started. And allowing the administration to back out move through Senate by saying, well, we're going to study it and set up a committee that has no return date, that's not even has membership yet, is not a way to rebuild trust. Trust is the essential element on a campus. I'm afraid it's lost, and it may not be recoverable with the present administration. That's a sad statement to come to, but if they had done it a month ago, I think it was recoverable. But my last comment will be, McGill is really strong if you ignore James and some of the deans. I've never had more conversations with my colleagues across campus, with students at all levels, with staff. People are coming to me, I'm sure they're coming to others, telling their stories, trying to figure out what can we do together. So McGill is really strong. Maybe we'll come out stronger, but we have to do something about our governance.
Thanks, Richard. And Richard, number 2.
I'll raise, Catherine, a point that was raised with me in a direct message but that I think has implications for a number of people who might be on this call, which is that strangely the university has been lackadaisical with respect to some of the collective impacts that we've been discussing, but very strict and arguably discriminatory with respect to other aspects of its EOC implementation. So for example, people who want to travel are now under very strict controls. I happen to have a doctoral student who is probably in the safest place in the world right now on the Harvard campus, got to the Harvard campus on a fellowship. And if he follows the McGill rules, he has to come back to McGill to get authorization to go and also to get authorization to have ethics approval for his research. There's an absurdity to this. There's a kind of Kafkaesque quality to the way in which the university has structured its response. It's putting strict controls where there shouldn't be the strict controls, where we ought to have some, reasonable assessment of where people are really at risk. And then on the other hand, it's doing virtually nothing when it comes to the collective impacts on the community.
Thanks, Richard. That's a good experience to cite. I also had a practicum student, a Parisian living in Paris, who wanted to do her practicum in Paris. And it was so hard to get approval for that. Claire.
Yeah, so I had two things that I regret not touching on sooner, but now I can speak about. There's been sort of towards students, there's been this huge attitude of, well, you're not experts, you're not doctors, you're not an epidemiologist, you don't know what needs to be done. And it's true, I'm not a doctor, I'm not a lawyer, but when I look at leading experts in the fields around the world and at McGill, and I say, well, these people think it's the right thing to do, these people think it's legal, these people think it's ethically and medically justifiable. Why doesn't McGill believe the same? And another thing that I was hesitant to touch on at first, but I feel like this discussion has been explored enough, is that studying at McGill is a privilege. There are certain human rights that most can agree that everyone should be afforded. But the fact of the matter is that being admitted at McGill is a privilege of itself. You can have that privilege revoked if you do things that aren't illegal, but the university has deemed to be unacceptable. So plagiarism, that McGill, if you plagiarize, McGill has the right to impose sanctions on you or ask you to leave the university. It's not a sacrosanct, irrevocable privilege to be a McGill student. There are certain things that you have to do to maintain that, to ensure the campus is a safe place for everybody. And if some people aren't willing to abide by that, it's, again, this isn't a privilege that transcends all other privileges. Being a student at McGill is a privilege. Thank you.
Those are two really key points, Claire, and thanks for bringing them up. I think, Max kind of put into perspective a little bit this issue of, what are our rights and our responsibilities and our ethics. Max, some concluding remarks from you.
Yeah, maybe just to end, I'll bring us right back to basics. A pandemic is a public health emergency. And so let's remember the tenets of public health, right? It's about collective action. To Rin's great question, we're seeing an individualization of thinking about this and the medicalization of these sorts of efforts. This requires collective action. That's what we do in public health. The second thing is that public health is about prevention. I do think that once we start seeing cases on campus, that's when you react and put these sort of policies in place. So if we want to be preventive, you try to prevent those from happening in the first place. And the third thing is this commitment to equity. We have to think about risk in terms of their distribution and who bears the disproportionate risk in these circumstances. And that is falling upon the most vulnerable people on our campuses, and that is simply unacceptable. Thank you.
Thank you, Max. These are really important points that you've just made. And I'd like to hand over to Ari. This is I think the first in the series. So did we meet your expectations? And can we carry forward this conversation? We have a petition we can sign, and let's see how we can move this forward. It's going to be very embarrassing with Tony Fauci speaking October 1st if McGill still has its head in the sand. Ari.
Yes, Kate, to your question, no, my expectations were exceeded, but I think that is the difficult question ahead of us, is how do we continue this? How do we actually make some progress in the face of an administration which, based on this discussion, is not listening to its students, is not listening to its experts, And to Claire's point, I think your voice matters just as much as the experts and the staff members, and we probably should have had a staff member on the panel as well. And I find what's most frustrating, what's most concerning to me, in addition to it, not listening to its community, is the way that we're being fed misinformation, right? McGill telling us that there's a layered approach, and the approach that we're taking is anything but layered compared to our peer universities. Just as cases were starting to spike due to the Delta variant, we went to zero distancing. As it was noted by a panelist, we don't have a systematic approach to ensuring that there's adequate ventilation. Many classrooms are not ventilated. It's going to get cold soon. There's no systematic way of testing. In Epi and Biostat, we're fortunate to have a couple of environmental epidemiologists who are going on their own and actually doing testing in classrooms, but that's not a sustainable situation, right? They're just trying to bring attention to this, this shortfall on the part of the university. In addition, as you've highlighted, there's no approach for systematic testing, right? There's almost no accessibility towards rapid tests, as we're seeing in so many other universities across North America. And so I'm frustrated like many of you, and I'm hoping that we can make some progress. And as Kate said before, Dr. Fauci's talk coming up soon. So I'm hoping that we can keep this conversation going. That's the purpose of these types of panel discussions that we're trying to organize. And so thanks everyone for coming, and thanks so much, Kate, for moderating.
Thank you. It was a pleasure. Goodbye, everybody.
Thank you all.